Hi, this is Dan Palazuelos thanking you for the opportunity to be a Burke Fellow during the 2018-19 year. The Burke Fellowship has given me an incredible opportunity to expand the way I teach social medicine and global health to our trainees in Boston, Mexico, and multiple other countries where Partners in Health works. It was an incredible opportunity, and I believe that this work will continue for years to come. Thank you.
Hi, I'm Marcia Savetti. I wanted to say thank you to the Burke Fellowship. It was an amazing fellowship to have, and it came in at such a fortuitous and important time. My lab had applied to the fellowship to develop technologies to sequence arboviruses like Zika, and just at that time, the Zika epidemic, kind of unbeknownst to us, was spreading throughout the Americas. And so it allowed us to take the technologies we're developing and rapidly move them into sequencing the virus. We were able to build this technology and sequence the virus from 11 different countries and to produce a really important data set that was helped us understand the spread of the virus and also provide information that was important for diagnostics and therapy development and beyond. And so it really came at a special time. It shows the catalytic effects of an award like this, and I cannot thank you enough from me and my team for making this possible.
Greetings, everybody. I'd like to take this opportunity to extend my sincere appreciation to the Burke family for their support of global health fellowships at Harvard. The fellowship has allowed me to continue working in West Africa with Ebola survivors, and the data we've collected has allowed us to apply successfully for 2 NIH grants. And so the support for someone like me in a junior faculty stage has been very impactful. Sorry I can't join you this evening, but I'm in Sierra Leone. But I do wish to express my sincere gratitude for the Burke's support of global health equity.
My name's Rene Salas, and I'm an emergency medicine physician at Massachusetts General Hospital. When I learned about climate change in health 6 years ago, I recognized that it was the greatest health emergency facing our country today. And as an emergency physician, I wanted to, one, be able to address this health emergency in the best way possible. And I knew that that meant generating new knowledge. However, there isn't funding right now, nearly not enough what we need, funding to figure out how climate change is impacting health and the healthcare system. So I developed a proposal that was funded, and I became one of the 2018 Burke Fellows to try to understand how is climate change impacting our healthcare systems, and especially for the Medicare population. Without that funding, I would never have been able to jumpstart this work, and it has now allowed the generation of new knowledge that will engage new stakeholders into the fight for the climate crisis, and for us to learn how to better protect our parents and elderly neighbors, and thus those over the age of 65 during extreme weather events. It has also allowed me to jumpstart this whole area of my career, and without that funding, I wouldn't have been able to do that. So thank you.
I just wanted to say a big shout out and thank you to the Burke Fellowship for funding me when I was young in my career, which was pretty long ago, to right when the fellowship was starting, to explore an aspect of my work that was probably not something that I would have gotten funded through a normal mechanism, but through the Burke Fellowship I was able to actually dig in deep into a question in cerebral malaria about HIV, which resulted not only in multiple publications, but also a very successful PhD student in our laboratories completing her doctorate in that area. So it was a wonderful stepping stone for me early in my career, but also immediately led to mentorship and success of another young investigator as well. So it's a great program. I'm really glad it's out there, and I'm really glad that it continues to be funded, and I wish you luck in the future.
Hi, my name is Marcia Castro, and I am a professor at the Harvard T.H. Chin School of Public Health, and I'm sorry I cannot join you today. But I wanted to send a message. I'm very proud to be a member of the very first cohort of fellows, of Burke Fellows. At that time, I was just an assistant professor navigating the bumpy road of getting funding for research, and now I am a tenured professor and a department chair. The Burke Fellowship was instrumental to support my initial efforts to secure grant funding and to develop a research agenda. I was able to test a new analytical approach and to assemble a very large data set that supported my work on malaria in Tanzania. This kind of funding, seed funding, is absolutely critical for junior faculty to acquire initial results that then can lead into much larger projects. It's also a boost of confidence after you get many rejections from NIH, which is quite common if you work in a public health school. I want to sincerely thank the donors, Katie and Bob Burke, for their generosity and for their vision. Supporting the work of junior faculty is extremely important at a time when funding is not exactly the same as it used to be before 2008. Therefore, I want you to be certain that your generosity is helping many of us to succeed in our career and helping us to produce high quality research that impacts society. So from the bottom of my heart, thank you very much.